Hello, welcome to this informational video about treatment with Lutathera. We are nuclear medicine doctors in Alberta. We helped create this video to help patients better understand what it means to have Lutathera treatment and what to expect during treatment. It's completely normal for you to feel overwhelmed or have many questions. You're not alone, and we're here to give you information about this treatment and what will happen. In this video, we will give you basic information about what Lutathera treatment is, how it is given, the tests you will have during treatment, the safety rules for this kind of treatment, and some of the common side effects. We will also explain what will happen at your consult appointment and where you can find more trusted information.
Lutathera treatment is prescribed by nuclear medicine doctors. We are specialists that work with radioactive materials to diagnose and treat diseases. Lutathera is a radiopharmaceutical medicine. This means that the medicine contains radioactive material that gives off radiation. You can't feel radiation, or see, or smell it. The medicine is designed to find cancer cells in your body, so that it can destroy those cancer cells with radiation. The radioactivity in your body is the highest when you get your Lutathera treatment. Over the next 1 to 2 days, most of the radioactive drug is removed from your body through your pee. Lutathera is used to treat neuroendocrine tumors that are metastatic or can't be removed with surgery. Neuroendocrine tumors can grow from different organs like the lungs, the pancreas, the intestines, or others. Currently, Lutathera treatment is available for tumors that grew from the pancreas or the small intestine. Ask your doctor if you need information about what this means for you, based on where your primary tumor grew from, and if you may be eligible for this treatment. The cancer cells also have to have a special protein on the outside of the cell, called a somatostatin receptor. This receptor is how the medicine finds the cancer cells and goes inside the cancer cell to deliver radiation and kill the cancer cell. Studies have shown that treatment with Lutathera can improve a patient's progression-free survival, which means the amount of time a patient lives with their disease without it getting worse. It can also help manage some of your symptoms. Lutathera is a radioactive drug. It is prepared and given to you in a specially controlled room in a cancer center. It is given to you intravenously through an IV in your arm. Your appointment will take about 4 hours, and you will be given other medications with your Lutathera treatment. You will need to drink plenty of water following each of your treatments. This will help you to pee or urinate more often and flush the drug out of your body. The treatment is given once every 8 weeks for up to 4 treatments. You will need to have blood work done within the 2 weeks before each treatment, as well as 4 weeks after each treatment. In between your treatments, you may have imaging scans and other possible tests to check how your body is responding to the treatment. These tests will help us decide if we can continue the treatment or if we need to make changes, take a break, or stop giving the treatment. Since Lutathera is a radioactive drug, you will need to take some radiation safety precautions after each of your Lutathera treatments are given. You and your bodily fluids, like sweat, blood, mucus, and urine, will be radioactive, so you will need to take a few steps to reduce the risk of exposing the people around you to radiation. The people around you will not be able to tell that you are radioactive. While the amount of radiation you give off is very low, you must follow the safety instructions for several days after each of your treatments to keep everyone safe. This includes keeping your distance from other people, avoiding sexual activity, carefully using the washroom, and storing garbage with bodily fluids on it in a safe place. We will now go over these steps in more detail. You will be given a handout with this information in it at your consult appointment. For the first 7 days after your treatment, Avoid close contact with others, including adults, children, or someone who is pregnant. You can do this by keeping at least 2 meters or 6 feet between you and others. If you need to be closer together, like when you are driving home from the treatment, sit as far as possible by sitting in the back seat on the other side of the car as the driver. For the 7 days after your treatment, always sit to use the toilet. Use toilet paper every time. Flush it in the toilet and wash your hands. Put any garbage items that contain your body fluids like blood, urine, feces, or vomit into a plastic bag. This could include Band-Aids, gloves, urinary catheters, and colostomy bags. Store this garbage in a safe place away from children and pets until it is safe for you to add it to your normal garbage for collection. For the first 7 nights after your treatment, you will need to sleep in a separate room from another adult. Make sure there is still 2 meters or 6 feet between where you sleep. Continue this for 15 nights if you sleep in the same room as a child, or if you share a room with someone who is pregnant. Shower every day for 7 days following your treatment. And wash your laundry separately from other people's clothes for the first 7 days after your treatment. If you are admitted to hospital during your Lutathera treatments, tell the staff that you have had this treatment and the date of your treatment. The staff may need to take radiation safety precautions, especially if this happens in the 7 days after your treatment. Avoid sexual activity with a partner for the 7 days after your treatment with Lutathera. If you are sexually active after these 7 days, use birth control when there is a risk of pregnancy. The radiation from your treatment can damage sperm, eggs, and a developing baby. Avoid making a baby or embryos while you're getting Lutathera treatment. After your treatment is complete, wait 7 months if you are female or 4 months if you are male. Keep your treatment discharge letter with you if you travel in the 3 months following your treatment.
The following side effects can be common and expected from treatment with Lutathera. Experiencing nausea is common and can be helped by taking anti-nausea medication. Feeling tired or fatigued, which may last for 1 to 2 weeks. Take plenty of rest when you need it. You can also have low blood counts while on Lutathera, which will be carefully monitored with blood work throughout your treatment. During your first appointment with a nuclear medicine doctor, we will go over your medical history, review specific radiation safety steps based on your lifestyle, go over possible side effects, answer your questions about treatment, and get your consent to have treatment with Lutathera.
Thank you for taking the time to learn more about Lutathera treatment, the radiation safety steps you need to follow, and possible side effects from the treatment.
You may be wondering what you can do while you wait for your appointment. Try thinking about what your questions are and writing them down. You can also visit the Cancer Care Alberta Patients and Families website or other trusted websites for more information.